When someone's diagnosed with epilepsy, it generally means that they've had more than one seizure. So a seizure happens when there's a misfire of an electrical impulse in the brain. So we all have electrical activity that's happening in our brain all of the time, and seizures can occur when there's a misfire of one of those electrical impulses and it causes them to have a seizure. But typically, if someone just has one seizure, or children under the age of 5 can have fevers and have seizures, it doesn't necessarily mean that you have a diagnosis of epilepsy. There's many treatments available, and every year there's actually more and more in terms of pharmaceuticals. So typically the first line, if we have diagnosed someone with epilepsy, they've had several seizures that have actually been identified through an EEG, as well as clinical presentation of an actual seizure. We get them on a medication. There's actually more than a dozen medications available on the market. In some cases, children don't respond to the first, second, or third medication that is given to them, and then we can look at different therapies outside of pharmaceuticals or in conjunction with pharmaceuticals, such as the ketogenic diet, or vagus nerve stimulator, or possible surgery if they're a candidate. I think a lot of people think that if someone has seizures or someone has epilepsy, that there's something else wrong with them. So they can't be, quote, a normal, healthy person if they have epilepsy, and what else is going on. And it's actually something that everybody should know, is that you can have epilepsy and be absolutely totally healthy, functional, successful, academically, and in life while living with epilepsy. So it's really important for people to know that when you're out in the world, there's dozens and dozens of people that are diagnosed with epilepsy that you would never even know. Doctors, nurses, teachers, and just someone who lives next door to you, they could have epilepsy and you don't know. So if you find someone having a seizure, the first thing to do is call 911 so that you can get some medical attention and support for that person. The next thing you want to do is make sure that they are in a safe environment. They're not going to hurt themselves while they're having a seizure, and they're not going to hurt anybody else while they're having a seizure. If you can roll them on their side, it's good to do that. Sometimes there's vomiting associated with a seizure or after a seizure. If it's not possible, that's okay, but just make sure that they're in a safe area. And the other thing that you never want to do is put anything inside their mouth.